Everyone is a Seqster, and everyone is seeking health data. It doesn't matter if you're a provider, a pharmaceutical company, or a payer, or a parent, or any person. We are all seeking health data because healthcare and health data go together. We've created something that's going to blow everyone away. I want to show you what it is. We founded Seqster in early 2016, and we had one mission: put all your health data in one place. We are inspired by Mint.com, where you can actually bring your Wells Fargo, Bank of America, student loans, and see your net worth. And I always ask the question, why can't we see our net health? And if you are a healthy individual, you may not care about the health of yourself until you are sick, but you do care about a loved one's health. And so we started working with the Alzheimer's community actually, and understanding how we can create within the Seqster platform what a caregiver view would be, where you can manage a loved one's health through one platform. The problem that we were embarking on accidents happened when someone told us that you guys cracked interoperability. When all we were trying to do at Seqster is bring sequencing data with all other different types of data. We didn't know that this $30 billion problem called interoperability was front and center in the United States fragmented healthcare system. And so we kept going further and further, building small tools within the semantic interoperability, structural interoperability, and foundational interoperability. We came out of stealth finally in 2018. We were lucky enough that some very large figures in the world were taking a look at the interoperability space. One person was Mr. Bill Gates himself, who gave us a call personally and was intrigued to see what we had built with Seqster. After that, obviously, we had to come out of stealth. Our first customer was Boston University in mid-2018, where we launched the Seqster Research Portal, which allows both participants and researchers to have a data sharing environment to not only share data, but fast-track clinical trials and drug developments through software being as a service, and more importantly, showing how health data, as I say, is medicine. And then fast forward to last year in 2019, we inked our partnership and deal with the La Jolla Institute of Immunology, which hits on 5,000 asthma patients, where they're trying to find a longitudinal way to study the health data of these asthma patients. And we couldn't be more happy to be partnered with La Jolla Institute of Immunology. And then just recently, last month, the start of 2020, we were able to launch at JP Morgan Healthcare Conference our Seqster 5.0, which is our fifth iteration of the software release of Seqster, that includes so many different bells and whistles that both the payer community and the pharma community are looking for from a patient engagement platform. We couldn't be prouder than what the team has been able to achieve in such a short time with Seqster. Engagement within health technology and healthcare is probably one of the biggest problems that everyone is trying to solve. And the problem there is that we've always been focused around the provider. For the first time ever, with our mission at Seqster, we empower both patients and people to collect, own, and share their data on their terms. And that is only possible by giving full rights and ownership and control to the person that is in charge of their own health data, and no better person than yourself. There's no better way to engage people with their health data than putting them in the center so that they themselves can collect and own and share their health data. There's just lots of data that you don't really see all in one place, matched to your episodic care data. We put the person at the center of healthcare, disrupting all their EHR, DNA, and fitness wearable data, and allow people to share that data on their terms, where you control and collect, own, and share your data. At Seqster, we made a heavy investment on both privacy and security. We're hosted on a HIPAA compliant and high trust certified server, and every single user that collects their data or seeks their data through our technology has their own encryption key. With Seqster, when you collect your data, and let's say we have 10 million people using the technology and platform, we have 10 million encryption keys. We've also patented a timeline. Kind of like how you have a Facebook timeline for your pictures, that has no value. We have a health timeline. The biggest problem in healthcare is interoperability. At Seqster, we are so fortunate to have created the technology that cracks interoperability by putting the person in the driver's seat with our person-centric interoperability solution. This convergence of digital health and biotech is Seqster. Our latest milestone is our announcement of Takeda Pharmaceuticals' Digital Health Fund that just invested in Seqster. We couldn't be more excited and thrilled about the opportunity of Seqster being plugged in to the clinical trial and pharmaceutical world, really hitting on patient engagement in a way that we've never seen before.